Hamilton, Ontario's City Council voted unanimously this week to declare 3 states of emergency related to homelessness, opioid addiction, and mental health. Officials warn that the shelter system is overflowing, and opioid overdose deaths are 45% higher than the provincial average. To take a closer look at these 3 states of emergency, we've reached Brad Clark. He's a Hamilton councillor who spearheaded this call. Thank you so much for joining us this afternoon.
Well, thank you for allowing me to have this time with you.
Why did you recommend that these states of emergency be called by the City of Hamilton?
I took an opportunity to meet with our homeless shelter, emergency shelter operators, and I visited the shelters and met with many of the homeless people. And what they told me alarmed me greatly. One agency had 130% turnover in their staff. Another agency was losing staff because they couldn't handle this situation where, for example, a homeless family comes to seek shelter and you have no shelter, so you have to turn them away. So you can imagine the emotional turmoil that they're experiencing. We have hit now 1,500 homeless in Hamilton, and that number is growing. And throughout COVID, it has been a significant issue that we've been dealing with. And then on top of it, we have the opioid addictions, where over 800 residents across the entire city, not just in downtown, right across the entire city, experienced opioid overdoses and drug poisonings in 2022, and 150 people died. These are sons, mothers, daughters, neighbors, colleagues, bosses, and these addictions and drug poisonings know no geographical boundary. And I felt we had to somehow draw attention to the crisis that Hamilton is facing.
What are you hoping will be accomplished by declaring this state of emergency, or multiple states of emergency now? What are you hoping that might achieve?
Well, we're hoping that the province will commit to fully funding gaps in the mental health service, as well as funding ongoing annual increases, specifically being hit with inflation and of course, the population need. We would like to see a multi-sectoral task force appointed to guide the development of a robust provincial opioid response, because it is not just Hamilton that is wrestling with this. And then we'd like a long-term financial commitment to create more affordable housing and supportive housing for people who are really struggling and need that mental health support, and to handle their substance use disorders. So those are a few of the requests that we would like. But it's important that folks know that Hamilton has been contributing. Our total investment in housing and housing-related programs reached $146 million. Hamilton property taxpayers are paying 52% of that, with the province paying 26% and the feds are paying 22%. This is on the backs of property taxpayers. So we've hit the limit and we're asking for help.
You mentioned there that Hamilton is not the only community that is struggling with this right now. And of course, we've been talking about this a lot during the pandemic, that there are so many areas of this country that do have similar struggles right now. Are you working with any of those other communities to try and raise attention at the provincial level?
Yes, while I was looking at doing this type of emergency and creating that type of motion, I reached out to Alderman Diana Hewson in the Niagara Regional Council. They had just passed a motion for very similar requests of the provincial government. St. Catharines has done the same thing. So we now have large urban centers who are experiencing this, talking together about declaring these 3 emergencies and working with the province to resolve them.
What would your message be, if you could sum it up in a couple sentences even, to leadership at both the provincial and federal levels about what is going on and what you need help with?
I think I would say, please come and have a look at what is happening in these communities. We have mothers and children who are homeless through no fault of their own. The loved one lost their life during the COVID epidemic, and they're now on the streets. We're seeing huge numbers of families on the street. We're seeing people who are actually working but can't afford to pay their rent, so they're living in their cars. This is the reality in Hamilton, and we had heard it described by some of the emergency shelter operators as a dystopian situation, and we never expected it to see it this bad.
Brad, thank you. We really do appreciate your time on this today. Thank you for joining us.
Thank you so much for the time.